Hello everyone, welcome to another new video, that is liver function test. Today we are discussing about liver function test. Firstly, I am just discussing with you today's class outline. Firstly, we are discussing about introduction as well as what is liver function test. After that, why we will do liver function test. After that, what are the parameters are present in liver function test. What are the normal ranges and clinical significance? Today's class will be little bit lengthy, so that stay tuned with me and stay with me. Hopefully, you will understood everything regarding liver function test. Okay. Firstly, what is liver function test? In the shortcut, we are saying that LFT. It is an important test in biochemistry. That is liver function test. For doing the LFT, we are taking the blood in red vial, that is clot vial. Okay. Now, it may basically a blood test which mainly evaluate or analyzes the liver health. Is your liver are good, or your liver's function is good or not? Okay. Here basically measures proteins, enzymes, and some kind of substance which is related to the liver function. We are basically analyzes this kind of function into the liver function test. Now, why it is important? Basically, for diagnosis the disease like hepatitis, cirrhosis. Hepatitis means inflammation of liver. I denoted inflammation, and cirrhosis means damage of the liver cell as well as damage the liver uh, outermost layer, that is called cirrhosis. After that, monitoring the liver function during treatment. If any kinds of patient are suffering the disorder related to liver function, whenever we are giving the medication, liver function test will help us to analyze the treatment status. After that, if any kinds of liver damage due to toxin and alcohol consuming, we can easily analyze it, or we can easily identify through liver function test. After that, if any kinds of surgery are happening related to liver or liver transplant are happening, after that we can easily diagnose the status of liver, how it is. Is it good? Is the working function of liver is good or it's bad? After that, detect the jaundice as well as bile duct destruction. Jaundice means whenever the liver are not working properly, bilirubin level become increases, so that jaundice may form. We can easily diagnose this through liver function test. Okay, now it's a high time to discuss about the function. Without uh, or before going to liver function test, we need to understand that what are the functions of liver. If you are understanding that the function of liver, you can easily understand the liver function test, because whenever this kind of function are not occurring properly, you may find out that liver are not good, as well as you will feel the abnormal result of liver function test, abnormal result of protein, abnormal result of enzyme, as well as the parameter which are present in LFT. Now see, first function is a producing the albumin. Here I have presented the function aspect, only the aspect of LFT. LFT. And but here is the function, that is a generalized function. That's all about the function of LFT. Here is I have mentioned the only function which is required for liver function test. Firstly, for albumin, so that we have to analyze the protein at first. After the regulating the enzyme level, whenever I will discuss with you the parameters, you will understand it properly. Okay. After that, bile is the bilirubin level are proper or not. Okay, basically into the liver function test there are various type of parameter. One group of parameter in is protein, another group of parameter is enzyme, and last group of parameter is bilirubin. Understand? So that I have mentioned the function here, so that you can easily relate with the liver function test properly. Okay, now what are the function? Firstly, metabolic process. Liver help to metabolism. Liver help to production of RBC, that is called erythropoiesis, as well as liver are decomposition of RBC, mainly destruction of RBC is also happening by liver, not production, destruction, as well as decomposition, as well as storage of the reduced RBC or the destroyed RBC. After that, blood composition, liver is also maintaining the blood composition. After that, liver produce various type of hormones, liver produce vitamin. After the liver mainly detoxify the toxin particles, liver mainly produces the bile which is stored into the gallbladder, right? Okay. After that, liver help to production of the protein, as well as for synthesis of the protein, liver is required. That's all about the function of liver. Now it is a high time to discuss about the parameter. You can relate with the functions and parameters. Firstly, I have already told you that the function is firstly protein synthesis, right? So that the first protein is albumin. It mainly maintains the blood volume and pressure. It is a function of albumin. After that, total protein means A plus G. Okay, A means albumin, G means globulin. Whenever we are attaching these two or sum of these two, that is T means total protein. Understand? And you will get here total protein. After that, AG ratio. AG ratio means that is A divided by G. So you will get AG ratio. A is to G, or albumin is to globulin ratio. It compares the albumin and globulin level. Whenever it is normal, then we can say that our liver is working properly. Okay, the first parameter is you need to understand that albumin, after that protein, after that AG ratio. That's all about the proteins parameter. After that, here you can see the enzymes parameter is firstly ALT. Another name of ALT is SGPT, right? Serum glutamate pyruvate transaminase, and ALT means alanine transaminase. It indicates the liver damage. I will discuss these things later. Okay, and I have already mentioned into this PPT the risk portion as well as the clinical significance portion. You will understand from there. After that, AST, that is SGOT. Here is only difference in P. Here will be present O instead of P. Okay, SGPT is ALT and SGOT is AST. We have already understood. It mainly suggested the damage in liver, heart and muscle. SGOT. After that, ALP. ALP means alanine phosphatase. Elevated level mainly detected that the bile duct destruction and bone disease. ALP is required for the bone formation of bone. After that, here you will see the another enzyme, that is a gamma glutamyl transferase. It is a high amount whenever the bile duct issues as well as the alcohol consuming and happening too much. So that's all about the enzyme profile. Into the liver, there is one is the protein profile, another one is the enzyme profile, and last one is the bilirubin. Here is a total bilirubin. Total bilirubin means indirect and direct bilirubin. Whenever you will accumulate this indirect and direct bilirubin, you will get total bilirubin. Okay, and you will find out into the bilirubin there is a measuring of direct, indirect as well as total bilirubin. When it's elevated, jaundice may occur. Okay, that's all about the parameter. Now, it is the high time to discuss about the normal ranges and the clinical significance. I am mentioning into this two parts. First part is going on P for protein. We are discussing the protein parameters here, and after this slide, we will discuss about the enzyme parameter. Okay, here, firstly, albumin. What are the normal range? 3.5 to 5.0 gram per deciliter. Clinical significance, if low, it mainly indicate liver dysfunction, means we are saying that our liver are not working properly, our liver are not produced properly albumin. Okay, as well as malnutrition. Malnutrition means deficiency of protein related food as well as deficiency of protein diet. that is called malnutrition. After that, chronic liver disease means if any patient are suffering the liver disease too much high in day as well as in many days they are suffering in liver related disease. Okay, that is called chronic liver disease. After that, total protein means here will be present A plus G, that is albumin and globin. What will be the ratio? 6.5 6.0 to 8.3 gram per deciliter. You have to just memorize it. There is no other option. You have to just memorize it. Clinical significance means if low level suggests a liver disease, poor nutrition as well as protein losing condition, protein are decreasing, so that the total protein level you are finding into the LFT are decreases. Okay, after that, AG ratio, it is also an important parameter in the LFT. In various type of competitive exam are asking this question that what do you mean by AG ratio? That is normal range 1.0 to 2.5. A low ratio may indicate liver disease or kidney dysfunction because liver are not maintaining the ratio of albumin and globulin. Understand? So that we are saying that the albumin and globulin or AG ratio is not good, liver dysfunction are happening. Okay, that's all about the protein parameter. We have already discussed the protein parameter. Okay, now we are discussing about the parameter which is included into enzyme. See here, enzyme parameter, that is alanine transferase, that is ALT. We are also saying SGPT, right? Serum glutamate pyruvate transaminase, and normal range is 7 to 56 U means international unit per liter. Elevated level may suggest liver cell damage and commonly seen in hepatitis as well as liver injury. Hepatitis means inflammation of liver. Here is a causative agent is hepatitis B virus, HAV, that is hepatitis A virus, HCV, that is hepatitis C virus. There have also 5 types of hepatitis virus, right? Okay, if any kinds of hepatitis are happening or liver related disease or liver cell damage are happening, ALT become elevated. Okay, after that, aspirate transaminase, we can say that SGOT, right? Here is only T is instead to O, right? Here is a normal range 10 to 40 international unit per liter. It mainly high level indicate liver disease and heart related disease. Keep in mind that is some competitive exam are asked this question, as well as it is important question that which liver enzyme is essential for maintaining the heart health, as well as which liver disorder, which liver enzyme causing the heart disease into the patient or into the normal healthy beings. After that, alkaline phosphatase means that is also an enzyme which is produced by liver. Okay, here is also if it's elevated means denoted that it can indicate that bile duct destruction, so that this level or this enzyme level are elevated. Okay, after that, here will be the bone disease also. This parameter is also uses for bone disease. This is also an important parameter, as well as in various competitive exam are asked this question that which parameter in liver related to bone disease. You have to say that alkaline phosphatase, that is ALP. Okay, after the GGT, gamma glutamyl transferase, what is the normal range? 9 to 48. Okay, if it's elevated, you can say that that is the main reason alcohol abuse. If you are using or if you are drinking too much alcohol, it can see that your gamma glutamyl transferase level or GGT level may increases. Okay, in this high level suggested the liver related disease, bile duct problem, as well as alcohol abuse. So that I have already highlighted the things which is related to any kinds of enzyme. Here is a liver cell damage or anything I have already highlighted here. You may see into this PPT. Okay, after that, here is a report of LFT so that you can visualize the thing as well as you can take a practical idea whatever I have already explained to you. And I am not discussing about anything in the practical aspect. Practical aspect means how to you doing the bilirubin test, how to you doing the SGOT, SGPT. I will take the another classes for performing this kind of practical things, how it's happening. It's a basic class about, it's a basic idea about the LFT. Okay, see here. Firstly, the enzyme profile, that is SGOT. Here is the SGPT. Here is the SGOT and SGPT ratio. Here is the GGT. Here is the ALP. Right. That's all about the enzyme profile. Right. After that, bilirubin. See here, bilirubin, that is the normal range 0.30 to 1.20 total bilirubin. Here, okay. Here is the total bilirubin means direct and indirect. Here you can see direct bilirubin, indirect bilirubin, right? Okay. After that, you can see the total protein and albumin and AG ratio. AG ratio means albumin and globulin ratio. Total protein means whenever A plus G, you will accumulate A plus G, you will get T, means total bilirubin, total protein. Okay, so that whatever we have understood, that what are the parameter of liver function test, you may see that there is an enzyme profile, right? ALT, AST, ALP, and another one is GGT. There is mainly four enzyme. After that, whenever we are discussing about the protein, there will be firstly albumin, after that globulin, after that AG ratio, after that total protein. Here is 4, here is 4, 4, 4, 8, right? And another 3 is the bilirubin, direct bilirubin, indirect bilirubin, and total bilirubin. You will get 3. So the 3, 4, and 4, you will get total 11 parameter, right? Basically, you will get this 11 parameter in every report. Okay, and what will you do? You have to understand the normal ranges, you have to understand the clinical significance, if it's elevated, which kind of disease may form. Okay, and how the testing are occurring in individual parameter, you have to take in the idea. But nowadays it's an automated machine, so that does not require the and does not understanding required to understanding the whole principle, what how the tests are happening. Nowadays you can do it too much easily. Okay, see here, that is a jaundice condition. If normal condition, your sclera become white. In the jaundice condition, is become yellow because bilirubin level are increases, and the bilirubin level are increases into the superficial real. Okay, thank you very much.